So have you had clients tell you that the bill is expensive, and usually how do you address that?
Keep quiet and smile. No, I'm just kidding.
Hi everyone, welcome to another episode of Letstalkfurreal. I'm Mary, and today I have with me my co-host Derrick, and we also have our very special guest Dr. Ng, veterinarian and founder of VetMedic Vet Clinic. So hi Dr. Ng, please tell us a little bit more about yourself.
Thank you, Mary. Thanks for having me here today. I'm Dr. Ng. I started being a vet 8 years ago now, and have ever since practiced in Singapore ever since I graduated. I started VetMedic Animal Clinic 2.5 years ago now.
Okay, and what sparked your interest in this industry?
Well, it all started when I was in secondary school, when friends were talking about having pets, and then I thought, it's quite a nice idea to have a pet at home. So I begged and then never got one. So the interest grew from there. Started looking at how veterinary medicine works, and then started to go around clinics and gaining experience, looking at how clinic functions, what a vet does, and then slowly grew interest from there and decided to pursue veterinary medicine.
Right. So the interest must have been really strong, right? Because there's no vet school in Singapore. So you have to go overseas and it's really expensive. And
it was really expensive. My time, it cost somewhere around, if I'm not wrong, £25,000 a year to study.
Wow.
And it was a 5-year course. And being away from family, it's also one of the difficult parts of studying abroad.
Understand. So currently, do you have any pets?
We just lost one last year.
Oh, so sorry.
One of my cats. Really difficult. And the most difficult part is he passed away without us actually knowing why he passed away.
No.
And me being a vet, my wife being a vet, it was quite difficult for us in general because he slowly deteriorated. We seek other opinions, but we couldn't, at the end of it, we couldn't really find what was really wrong with him.
Is it quite common that for pets, is a bit harder to find out the reason why they're sick? Or?
It's not always possible. When they're sick, you have to manage them symptomatically or try to get them feeling a little bit better. You may not always be able to get to the bottom of it. But with current advancement in veterinary medicine, we're getting there. We're getting closer.
Okay, that's good to know, especially for people like us who have pets as well. Yeah.
Yeah, and also the other thing is he's not young. So one of the considerations is always, do you put him through any more or any further invasive procedures? You know, if he needs a surgery in order for you to know whether or not he's got certain to prove a certain diagnosis or presumptive diagnosis, it may be a difficult decision to make. Not just for clients, not just for owners, but for vets as well.
Yeah, I understand. Okay. So to lighten up the mood a little bit, so do you have any favorite breeds or species of pets?
I'm quite into brachycephalics.
I keep hearing this.
I've always wanted a Frenchie. Or actually a golden doodle or labradoodle. Not a brachycephalic, but one of my favorite breeds. Yeah.
Is it because how they look, or is it more like their temperament?
I think it's more of temperament. I like really active dogs, and Frenchies, they cannot stop jumping around. Yeah. Okay. Frenchie. My wife, who's also a vet, used to have a pug at home. And that's one of the other breeds that we like. Yeah.
Okay, cool. And any particular area of interest?
Yes, I do. I like surgery, and the good thing about surgery, even though it may seem to be quite invasive to many owners, is that we'll quite often be able to resolve and issue a medical condition with surgery and management. And quite a lot of medical conditions, for example, foreign body obstructions, despite medications, you will need a surgery to be able to completely resolve the patient's clinical symptoms.
Yeah.
And the good thing nowadays is that as we advance in veterinary medicine, we're able to, as GP, we're able to actually perform a lot more procedures. And this is through a lot of training, attending courses, and gaining hands-on skills to improve.
Yeah, I personally experienced that as well recently because my dog had an enlarged prostate and he wasn't neutered. So the vet actually recommended neutering to help with that. But because my dog has certain medical conditions and also I was a bit afraid to put him through surgery and GA and all. But then I realized that there's a lot more benefits that comes with it than the risk. Because a lot of times when we hear like surgery or even just GA, it's like, wow, scared already.
Yeah. I think the main concern that we get in a clinic is that can my pet take the GA? I think that's always the main concern. GA itself is actually really safe. Based on statistics, 1 in 10,000 animals can have some form of potential complication, be it big or small. And if you look at that number, it's really safe. And touch wood, I have never sort of have any severe complications such as death for GA. And even my colleagues, rarely ever will we have a severe complication.
Right, yeah, that's very comforting to know for pet parents.
Yeah, and also nowadays with whatever we are equipped in the clinic, gas anesthetic machine, close monitoring, and medical equipments to monitor vitals of the patient under GA, all that have made GA a lot safer as compared to the past.
Yeah. Because recently I took a diploma in the in veterinary studies, right? And one of it is on anesthetics.
Yeah.
And I was amazed by how many things are actually done to keep your pet safe.
Yeah.
And there's so many things like that goes behind it. Initially, you just feel like, it's either just gas or one injection. No,
yes,
there's a lot of things that's done.
Yes.
So yeah, it's actually very impressive how far we've advanced as well.
Yeah, and a lot of things, even though they all come from human medicine, but they have all been kind of integrated into veterinary medicine and our patients. And we know now a standard sort of numbers for patients to monitor. We know how to react to certain, for example, if the heart rate is low, how do we react? If the heart rate is too high, blood pressure is too low, how do we react? What do we do? Things like that. And that's all, it's a very common thing now in clinics that we train our nurses. We're all trained enough to be able to handle potential complications of GA.
Okay, great. So what are the 3 most important things that you would like pet parents to know as a vet?
I think knowing that, number one, their family member, treat them like family member. I think that's very important. We come across a lot of rescue cases, people abandoning their pets, particularly post-COVID periods. And we're still seeing the effects of that at the moment. That's number one. Number two, it costs money to basically keep your pet healthy. And it's important to recognize that even us, we need medical attention. Your pet will need medical attention. And the last thing is prevention is always better than cure.
Okay, yeah, really important. Derrick, anything to add?
Okay, Doctor, as For me, I don't have a dog or rabbits at the moment. Okay, but I used to have it. But I have the ideas that older dogs or cats are always not advisable to go to GA. Is that
Yeah, I think that's still the consensus. Just for record, like the oldest cat and dog I've ever anesthetized is 21 years old. So it's really, really old. It doesn't mean that you're old. If your pet is old, then it's not suitable for GA. If it's going to be a GA that's going to potentially help to diagnose or treat a certain condition, it's worth considering. And in the event that, for example, after your discussion with the vet, and then you found that it's a completely curable condition, then it's something worth considering. Yeah.
So before the GA, will there be any tests or diagnostic before?
Yeah, so we're lucky enough now to have medical equipments to be able to help us with that. For example, assessment of kidney liver function, and that's through a blood test. And then, for example, if your pet dog or cat has a underlying heart condition, it can be picked up through auscultation and then a follow-up ultrasound of the heart to know the status of the heart, whether or not the heart is able to withstand the GA itself, and that will give us a better general idea of whether or not your pet is able to undergo any GA procedure.
Okay. Great. Yeah. So, Dr. Ng, now we'll move into the main topic for today. So, are vet bills really so expensive? Nowadays we see in the news, different articles about pet parents spending so much on vet bills that they feel that everything is so expensive. So, the first question, firstly, do you agree that vet fees are expensive?
Yes, I do. But of course, not always the case. I think in certain procedures, for example, if it's a vaccination, a simple consultation, a dog that has been vomiting for one day, usually it doesn't cost a lot of money to see a vet. Vaccination usually ranges anything from $30-$40 to some clinics would charge about $80. Yeah. And that usually includes a consultation. So that means to say if you have any other concern with your pet, then it can also be brought up at the same time. And then the vet usually has an allocated time, be it 15 to 30 minutes, to basically answer your questions. Yeah. And of course, there are a lot of other conditions that can result in a larger vet bill. Yeah. And so just to go back onto the example of, say, a vomiting dog. If the dog has been vomiting for 5 to 7 days, is looking lethargic, then it's the vet may decide to run certain blood tests, carry out certain diagnostics, for example, X-rays or ultrasound, to first have an idea of what may be going on with your pet. And that's just the first step to diagnosis. And then there's still follow-up treatment, which may include things like surgery or hospitalization, things like that may not end up having a larger vet bill.
So have you had clients tell you that the bill is expensive, and usually how do you address that?
Keep quiet and smile. No, I'm just kidding. Always provide an estimate, giving them a quotation, for example, run through the bill, explaining to them why certain things are important or necessary. For example, if the bill does get quite big, then it's important that we know why we're paying for certain things and also the importance behind it.
So I think it's also important for pet parents to also ask for the estimated cost if they're not sure, right? If they're not provided in the first place.
I think just one point on that. I think it's not really how much a vet would charge. For example, just an example. If a clinic A charges $400 for a procedure and then another clinic charges $600 for the same procedure, and if you do a comparison, it's a $200 difference. But a pet parent that come in to clinic A or clinic B, may find that the 400 is too expensive. So it's the absolute amount at the end of the day that makes people think that it's expensive. Whereas Clinic A may think that I'm already charging it really cheap. I'm already $200 cheaper than another clinic. But people are still saying that I'm expensive. Yeah. So pet parents' perception of the procedure, what is included in the procedure, or diagnostics or whatever it may be, I think it's very important. Always run through the course with your vets so that you have a better idea of what you're expecting at the end of the day. And at the end of the day, everybody will be happy.
Okay, so could you maybe break down the factors that contribute to the cost of vet care?
Yes. So I think one of the things that people really need to understand is that vet clinics is a business entity, just like your supermarket, your clothing stores, your places where you get your necessities and things like that. And you have to understand that it's business, and there has to be enough funds to sustain the business. And a lot of costs will come from us improving ourselves, basically improving what the clinic will be able to provide. So, for example, having certain diagnostic tools like blood test machine, X-ray, and ultrasound, surgical instruments will cost quite a lot of money as well. Staff costs, labor costs, that's one of the main contributing costs. All these nurses that we have in the clinic, they work endlessly and they take care of, our patients, and rental costs, utility costs, equipment upkeep, maintenance cost, insurance. Yeah, all this will contribute to running of a vet clinic. Yeah.
This podcast is proudly sponsored by Hill's Prescription Diet. Does your pet experience food sensitivities and fat sensitivities? ZD Low Fat is specially formulated with hydrolyzed soy protein and low fat levels to help avoid adverse food reactions and promote healthy skin in dogs with food and fat sensitivities. The Active Biome Plus ingredient technology is clinically shown to rapidly activate the gut microbiome to support digestive health and well-being. Enjoy the benefits of healthy gut and healthy skin for dogs with food and fat sensitivities with Hill's Prescription Diet ZD Low Fat. Yes, that's all that benefit in one food. Visit your vet to learn more about how it can improve your pet's well-being. Yeah, I would say it would be pretty similar to a human clinic, right?
Well, your vets are your dentists. They are your surgeon. They're your internist.
It's like all in one.
Yeah. So we need a lot more things. I have a GP friend, and he started his own GP clinic. Must have been 2-3 years ago now. His renovation cost was around 40,000, while we put in close to 500,000 for renovation and for purchase of certain equipments.
Wow.
And things like so. There's a huge variation in what we need in a clinic, basically. Yeah, and I always have this true story to share with people. When I graduated 2 years in my third year, I was drawing a salary of close to about $4,000 a month. And my GP friend who's just finished his housemanship, and when he first came out and looked for a GP job, he was offered a salary of $13,000, but he rejected the offer because the salary was too low. So there's a huge salary gap with your GP and your vets, even though you would think that a vet is doing a lot more. But it's different in that sense because the kind of patients we see, the kind of requirements that we need, it's very different.
Right. Yeah, now that you say, yeah, it kind of makes sense because like at your vet, they can do your x-rays, your ultrasounds, they do your dental, they can do your in-house surgeries.
Yeah, and we don't, we're not born and then we know how to do ultrasound, we know how to read x-rays. We have to attend a lot of courses, continuous learning in order for us to be able to provide that service. And it's a blessing to be able to provide that service because, again, coming back to the example of having a vomiting dog, if you're not able to provide ultrasound service, you're not able to diagnose whether or not the patient has certain conditions that you would want to be able to treat. And it's important. I recently, I'm attending this course in the UK, a surgery course, and it costs almost £15,000 to do a surgery course. So it's in order for us to continuously learn more and do more, it also adds the cost of running a practice basically.
Yeah. So I'm sure the cost varies from normal consultation to like specialist consultation to emergency. Maybe you could tell us a bit more on that.
Yeah, it does. So a GP clinic usually charges anything from $30 to $80 for GP clinics, and a specialist would charge anything above $200. But you're basically paying for their expertise and knowledge. And emergency setting in a hospital setting can be anything from 150 onwards. Yeah.
Okay. And I guess advancement in diagnostic technologies such as our advanced imaging, now we even have hospitals that have, I think, MRIs as well, right? So that would also definitely affect the cost of veterinary care as a whole.
Yes, but it's a good thing, isn't it? Yeah, it's a good thing because now we're able to definitively diagnose based on imaging and then be able to treat more accurately. And of course, at the end of the day, help the patient.
Yeah. So what would you say is currently the most expensive contributing factor to the vet bill?
I think possibly the highest contributing factor would be staff costs. That's number one. And it's been on the rise for the past few years. And also basically improvements from the clinics themselves, being able to upgrade to different equipments, better equipment. Some of the ultrasound machines now even come with AI technology.
Oh wow!
Being able to tell you where where they think the problem is, things like that. So all that will contribute to the cost of vet bills.
Actually, just curious, right? How much does an ultrasound machine cost?
My ultrasound machine is close to 100,000. Yes, and it's really good. It gives you really clear images, and I have a client who is also an imaging specialist, a human imaging specialist, and he too was impressed with how the machine looks.
Wow, 100,000. That's a lot of money.
Yeah, I'm working hard to pay it off.
So, all right, let's maybe talk a bit about the pet parents' perception. So, why do you think pet parents feel that pet care is expensive? Because if we compare human healthcare and pet healthcare, they're actually just as expensive, right? Yeah, so why do you think that's so?
I don't think people are not complaining about human healthcare being expensive. I think it's just maybe we're not hearing it.
Yeah.
That's number one. Number two, of course, if you're in a government hospital, the cost is usually quite heavily subsidized, including medications, treatment, and you have your personal insurance to help you cover parts of the bill as well. But pet insurance is one of those things that is on the rise at the moment, but not yet fully utilized. And because of that, I work in a vet clinic, I'm going to hear a lot of people that will tell me that vet bills are expensive. Yeah.
Yeah, like we also mentioned just now that actually a lot of equipment and medications and all is actually very similar, or sometimes even more than a human-sized GP clinic's requirements, right?
Yes.
Yeah. So are there any steps that you have taken to reduce communication or anger from pet parents when they see the bill?
Always run through the bill, always provide an estimate, especially if we feel that it's going to be a big bill. And all the vets in my practice, and actually a lot of vets that I worked with, always have that habit of just running through the bill, making sure and explaining each item on the bill to basically get consent, number one, but also to make known to the owner that this is how much it's going to cost, and this is what we're going to do, what are we expecting, things like that, so that the owner understands that the rationale behind doing certain things.
Yeah, and I think we as pet parents, if we're unsure, we should just ask, right? Rather than guess and then, there's miscommunication
Yeah,
and all.
just for again for another example, a clinic would be doing a very routine castration procedure. In this clinic A may charge this amount, clinic B may charge that amount, but always try to find out whether or not what's included in the cost and what is the total estimated cost.
Doctor, can you elaborate more about the pet insurance comparing to human insurance?
Yeah, so pet insurance in Singapore is on the rise at the moment. A lot of people are taking it up. Some of the insurance company would cover certain hereditary condition or congenital condition, but some may not. As far as I know, I think the co-pay percentage at the moment for treatment, including surgical procedure, is about 50%, if I'm not wrong. And there's still a lot that the owner would have to fork out, but it would also mean that in the very unforeseen or unfortunate circumstances, you are covered, and it does help to reduce vet bills. Local insurance company are working really hard to increase and improve their coverage, which is a good thing. I remember when I was still a student in UK, I brought my cat for investigation of breeding issue, and my cat ended up having a CT scan done and a rhinoscope, which is basically a scope up the nose to have a look and try to diagnose whether or not there's an obstruction, any masses in the nose. And I do remember the bill coming back to be about £9,000, and the insurance was fully covered, and it was all fully paid for. So I was fortunate because I was a student and I don't have that much money to basically pay for pet healthcare in the UK.
Wow, that's quite a big difference. Yeah, so hopefully, in the future, pet parents also have the luxury of this insurance. But like what you said just now, it's better than nothing, right? At least we still have an option of insurance in Singapore.
Yes.
Yeah.
And I do encourage pet owners to have a look at the pet insurance in Singapore and take them up and pick the right level of coverage for their pets.
What's the percentage that you are looking at in your clinics now that pets have insurance?
I think that's a very good question. I think it's probably less than 10%. Yeah.
And I put it in the sense that the premium are a lot more higher. That's why people.
Sorry, I haven't kept myself up to date with exactly how much it costs now. But if I'm not wrong, it's anything from $200-300 to maybe $600-800, something like that. If I'm not wrong.
I think it's a pretty reasonable pricing in terms of the premium wise. From what I remember, I think it was like $50-60 a month.
Yeah.
Kind of thing. Yeah.
Yeah. Have a look, and then I think choose the right tier or level of coverage for your pets. I think that's very important. because it does help to reduce vet bills. If human, most of us are now covered healthcare insurance wise, but it's something that is still that's still not very popular with the pet owners. Yeah.
Okay, so is there anything else you would like to let pet parents know regarding this overall topic?
No.
All right, great. Yeah, I think we've covered really a lot, and it's really great information for all pet parents out there. So we've come to the end of the episode today. Thank you, Dr. Ng, and we will see you guys in the next episode.